Hi children, today's our topic is about private health services. Okay, so last class we studied about public health care services. Today we will study about private health care services. Private health care services are set up by individuals and corporates. So who will set up private health services? Individuals and corporates. Individuals and corporates. Private services, health services are set up by individuals and corporates. Then we will look about the facilities. Facilities offered by the private hospitals, that you know. Facilities offered by this hospital and health care centers are better than the public hospitals. So the facilities offered by the private hospitals and healthcare centers are better than the public hospitals, because you know the aim of these hospitals is to generate business and maximum profit, or making more profit. That is the main aim of this type of private hospitals and private healthcare centers. Okay, mainly this type of health services are set up in the urban areas. So in the private healthcare services are mainly set up in which areas? Urban areas. 80% of the health services in India offered through private health services. 80% of the health services. Okay. So children, government alone can't cater the needs of the people. Government alone can't cater to the needs of the people. So what the government, with the support of government, or government allotted some land at a subsidized rate for the private entities to set up their hospitals. So question will come, why government is allowing private entities to set up hospitals? So we can tell that government alone can't cater to the needs of the people. So what will happen? The government, with the government allotted land at subsidized rate, private entities, they will set up their hospitals. Now we will look our next topic. What are the measures taken by the government to ensure equality in health? What are the steps taken by, or what are the measures taken by government to ensure equality in health? So now we studied many private and public health care services are available in India. So you know every people can't afford to go and to take health services in the private sector. So government is taking many steps to ensure equality in health among the people. One steps we can tell, Pulse Polio campaign. That is a step taken by government for ensuring equality in health. So first one, Pulse Polio campaign. Pulse Polio campaign. Actually, the government started Pulse Polio campaign from 1995 to 1996. 1995 to 1996 government started Pulse Polio campaign, and it became a great success. So 27th March 2014, WHO, World Health Organization, declared India as a polio free country. So which month and year WHO declared India as a polio free country? 27th March 2014. 27th March 2014. WHO, World Health Organization, declared India as a polio free country. So this is one step taken by government to ensure equality. Okay, equality in health. Second one, we can tell government also working with the private sectors on public-private partnership. Private-public partnership in areas of family welfare and eradicating AIDS-related diseases. So that is another steps taken by government to ensure equality. Okay, government is also working like along with the private sectors, like a public-private partnership. Okay, private-public partnership for what? In areas of family welfare. In areas of family welfare and eradicating AIDS-like diseases. Eradicating AIDS-like diseases. This is another steps taken by government to ensure equality among the in health. Our next topic, gender discrimination, whether women facing any discrimination in health. Okay, on the basis of gender discrimination, woman is facing any discrimination in the field of health. Now we will study. Okay, so we already learned our health, many public and private health facilities are there in India. Despite the growth of health facilities, most of the women in India do not have access to it. Women are not getting proper health facilities. The main reason, patriarchy. So our society is patriarchal society. Patriarchy means male dominated society. So what is the main reason women are not accessing proper health facility? The main reason, patriarchy. Okay, women are socially, culturally and economically depends on men. Socially, economically and culturally depends on men for the provisions of health services. For getting health services, they are mainly depending on men. This prevent them for getting proper health treatment. So this prevent them getting proper health treatment. Okay, so gender discrimination make women more vulnerable to various diseases. So gender discrimination is one main reason why women are becoming more vulnerable to various diseases and high death rate during the time of childbirth. During the time of childbirth, we can see many high death rate among women. That why it is because of gender discrimination. Okay, they are not getting or they are not assessing the health facilities properly, so they are more vulnerable to various diseases. I think you got. Mainly it happened in remote areas. Women living in remote areas, they are not getting better treatment. Okay, they are not taken into hospitals or health centers in case of any illness. So this is mainly happening in the remote areas. Okay, government and non-governmental organization taking many steps, or they are trying to educate women related to health issues. Related to the health issues, they are giving education and they are giving many awareness to the women for regarding to the health issue. Many government and non-governmental organization taking steps for this. I think you understood. So from these all we can conclude that gender discrimination is in case of health facilities, gender discrimination is visible in case of health facilities. Our next topic, healthcare in India today. Okay, so we already learned the government is responsible for providing equality in healthcare services, especially poor and disadvantaged section of society. Okay, so but the health condition of people, we can tell now also the health condition of people is not so sound. Means we know many government hospitals are there, many health centers are there, dispensaries are there, still it is not working in a regular basis, or it is not providing better health to the people. In many hospital, many sufficient doctors are not there, then health workers are not there, nurses. So many reason we can tell why our health condition of the people is not so sound even today. Okay, anyway, social economic condition of the people along with the healthcare facilities needed to be addressed in order to improve the health of people at large. Okay, so I think children you understood about this chapter. In this chapter we mainly studied about private and public health facilities in India. Now everybody take your textbook for doing textual exercise. Page number 213, first section A, fill in the blanks. Public health is the responsibility of dash, government. Second one, the infrastructure in dash health services is better than dash health services. Private health services is better than public health services. Third one, health is a state of dash and dash well-being. Health is a state of physical and mental well-being. Next one, primary healthcare services are provided by dash in rural areas. Primary healthcare centers. Fifth one, dash makes women more vulnerable to various diseases. Gender discrimination. Now next section, section B, state whether the following sentences are True or false? First one, health is the sum total of physical, social, economic and mental well-being. True. Second one, people in rural area have access to medical facilities. True. Third one, due to gender discrimination, there is high death rates during childbirths in our country. True. Fourth one, the government is mainly responsible for providing health care to poor and disadvantaged group. True. Last one, both the public and private sector contribute to health care. True. Okay. Now ma'am given some question from C, D and E section for writing the notebook. So that all questions write in your notebook and fill in the blanks and true or false that do in your textbook itself. Okay. I think today's topic is clear to you. If you have any doubt, ask me. We will meet in the next class.